part 2 of the schizophrenia spectrum presentation. Regarding interventions. There are various interventions that have proven to be effective in the treatment of schizophrenia. Interventions for schizophrenia can include antipsychotic medications as well as some psychosocial interventions. Interventions for schizophrenia are often necessary throughout the person's life, although at times the symptoms related to schizophrenia can appear to be in remission. Continued treatment is necessary to maintain that remission. There are dozens of antipsychotic medications that are utilized to treat schizophrenia and related disorders. And these antipsychotic medications can be categorized as first-generation antipsychotics as well as second-generation antipsychotics. First-generation antipsychotics are typically less expensive but associated with more adverse side effects, including movement disorders that could become permanent. And it's important to note that first-generation antipsychotics are described as those that were made prior to the 1980s, as opposed to second-generation antipsychotics, which have been developed since the 1980s. Regarding first-generation antipsychotics, psychiatrists can utilize other medications to help alleviate some of those adverse side effects that are associated with those first-generation medications. Regarding second-generation antipsychotics, they are typically associated with less severe adverse side effects, and so it may be important to really look at what types of adverse side effects your clients are experiencing when you decide to have a discussion with their psychiatrist. In addition to antipsychotic medications, there are various psychosocial interventions that can be helpful in improving outcomes among those who have been diagnosed with schizophrenia. Some psychosocial interventions that have demonstrated effectiveness include cognitive therapy, which encompasses cognitive behavioral therapy as well as other cognitive therapies such as cognitive remediation therapy. Psychoeducation is also very beneficial, as well as family intervention, social skills training, and assertive community treatment. I'm not going to go into too much detail about those interventions right now because in the literature review at the end of the presentation, one of the articles discusses these interventions at length, and so I'll just save it for a later slide. Another type of psychosocial intervention that can be beneficial is vocational rehabilitation, which can be used to assist those diagnosed with psychotic disorders and help them to maintain employment. This one is really close to me personally, as one of my first jobs as a BSW, after I graduated with my BSW, was that of an employment specialist. And so we helped individuals. We really took an individualized approach, and we met with an individual for 8 to 10 hours at minimum to really get to know them and some of their symptomology and to really see what types of jobs would be best fit for them. And I served several people who had been diagnosed with schizophrenia, and it's really, just anecdotally, I can say it's really important for individuals who want to work to be able to gain employment and maintain employment, because that really goes a long way in improving their self-esteem. Just in my experience, individuals who had been diagnosed with schizophrenia often had low self-esteem and really stigmatized themselves and talked down to themselves quite often. So just being able to maintain employment was very helpful. In addition, when working with individuals who have been diagnosed with schizophrenia, there are various multicultural issues to consider. Firstly, schizophrenia is more common among some groups that include individuals from developing countries, as well as immigrants and migrant workers. Zeid and Gray discuss how some view schizophrenia as a label utilized to categorize individuals who do not abide by accepted cultural norms. So, to the average person who might see someone that is diagnosed with schizophrenia, it may appear as they're just not abiding by the type of behavior that's expected of them in the culture that they live in, and because of that, there might be some type of a cultural bias in diagnosing schizophrenia, and really just the utilization of schizophrenia as a label for those who do not abide by accepted social standards. Zide and Gray also cite works that discuss the detrimental effects of applying the schizophrenia label to individuals, as it may cause them to display behavior outside of cultural norms, thus exacerbating the issue. An example that they gave was if an individual is diagnosed with schizophrenia and they have stigmatized this label of schizophrenia, they may withdraw and start to pull away from mainstream society. And as such, it really becomes a self-fulfilling prophecy when we talk about those diagnosed with schizophrenia not abiding by quote-unquote accepted cultural norms. Practitioners should be sure to explore clients' culture as it relates to mental health. Various cultures around the world have different viewpoints on mental health and mental health treatment, so it's important to explore this with your clients. Various cultures respond differently to schizophrenia diagnosis and have varying degrees of stigma attached to such a label. One thing is really important when thinking about multicultural issues, and that's family interventions. For example, Latino families are often much more close-knit, so that may be something to consider when you're working with your clients. Above all, enhancing social supports and relationships can improve outcomes, and we'll talk about that more in the literature review as well, but it's really important to utilize those support systems that already exist in the client's environment. And on the other side of things, stressful environments and a lack of support can often worsen outcomes. All right, now on to the literature review. The first article discusses current psychosocial approaches to treatment. So Cheen and Yip authored a literature review titled Current Approaches to Treatments for Schizophrenia Spectrum Disorders, Part 2, Psychosocial Interventions and Patient-Focused Perspectives in Psychiatric Care. And this literature review summarizes the utilization of psychosocial interventions that are utilized in conjunction with medication for the treatment of schizophrenia and related disorders. So I think this, just right off the bat after reading this article, I think it's very informative regarding the various approaches, psychosocial approaches that can be utilized in treatment. The authors conducted an exhaustive search of multiple databases and ultimately identified 92 articles that met their criteria for rigor and primarily focused on schizophrenia diagnoses. From these articles, they categorized the interventions, and 5 interventions were identified as demonstrated efficacy and alleviating symptoms. As discussed in a prior slide, cognitive therapy, psychoeducation, family intervention, social skills training, and assertive community treatment were among those interventions. Now on to the various psychosocial approaches that were discussed in that article. The first one being cognitive behavioral therapy, and CBT can be utilized to assist clients in challenging their belief and to develop skills that allow them to rationally cope with their symptoms. It's really important to note here that the goal of CBT in this context, and really should be in any context when treating schizophrenia and related disorders, the goal of CBT is not to challenge any delusions or hallucinations that the client may be experiencing, but instead to challenge their beliefs related to how they feel about their diagnosis or how they feel about their ability to cope with the symptoms related to their diagnosis. So really it's just it can be an empowering experience for the client. The authors also discuss the presence of evidence suggesting that CBT is effective in reducing symptoms for periods lasting 9 to 12 months. However, unfortunately, there's a lack of evidence at this point demonstrating the efficacy of CBT in alleviating symptoms long term, so those 2 years or more. Another cognitive approach that can be utilized is cognitive remediation therapy. The authors discuss the fact that psychomotor function, attention, working memory, executive function, and other cognitive functions may be hindered among those diagnosed with schizophrenia. Cognitive remediation therapy utilizes a series of interventions to improve this cognitive functioning. And they also discussed in their article how the improvement in cognitive functioning can often be beneficial for other types of interventions later on, such as CBT, as that increase in cognitive functioning allows CBT to be more effective. Um, Additional psychosocial approaches include psychoeducation. Psychoeducational interventions focus on informing clients of their illness. This includes information related to symptoms, treatment options, symptom management, and available resources. Again, just rooting back to empowerment, psychoeducation can be a really empowering experience for individuals who experience a wide variety of disorders, schizophrenia, and the whole spectrum of disorders included in the DSM. The authors discuss the fact that psychoeducational interventions have been shown to improve treatment compliance and reduce relapse, especially in the short term. So I think that's really important, as a lot of times individuals who have been diagnosed with schizophrenia adhere to treatment at first, and then once the symptoms start to go away, they feel that they don't need the treatment anymore, and so treatment compliance is often an issue among these individuals. Family-based intervention has also been utilized in varying modalities, which include providing psychoeducation regarding illness to the families, as well as the utilization of support groups. Social skills training can also be utilized to improve client functioning in their environment. And social skills training seeks to enhance communication and the ability of the client to function in social context. Social skills training demonstrated a moderate effectiveness in improving social functioning. So, as I discussed a few minutes ago, sometimes individuals who have been diagnosed with schizophrenia withdraw from society and withdraw from the social relationships that they had prior to their diagnosis, and as a result, overall social functioning decreases. So these types of interventions can really go a long way in improving this functioning. Assertive community treatment, or ACT, is a method of case management that involves intense outreach on the part of the ACT team or the case management team. And assertive community treatment has demonstrated efficacy in reducing hospitalization, homelessness symptoms, and improved quality of life. So I think that this article, just this one article, gives a wide variety of information that we can take with us in the field. The next article in the literature review discusses the effects of antipsychotics. Specifically, the article is titled Effects of Antipsychotic Medications on Psychosocial Functioning in Patients with Chronic Schizophrenia, finding in the NIMH CATIE study. The study analyzed the effect of antipsychotic medication on psychosocial functioning as determined by the quality of life scale. In that study, 455 patients completed the study and were initially randomly assigned to various antipsychotic medication. So what they really wanted to do was look at the various antipsychotic medications and see if there was a difference in improvement related to psychosocial functioning among those various options. At the 12-month mark, which is their primary goal, was looking at the effects as they appeared at 12 months. Patients utilizing olanzapine, perfenazine, ziprasidone, and risperidone demonstrated a statistically significant improvement in psychosocial functioning. Other factors affected outcomes as well, including the fact that women improved to a greater degree and the fact that those who abused substances did not improve. The authors suggest utilizing other psychosocial interventions to enhance functioning in conjunction with medication. So that's beneficial for us because we just looked at the various psychosocial interventions that can be utilized. The last article that I will discuss in this literature review talks about the therapeutic alliance in treatment. Specifically, the article is titled Psychological Treatments for Early Psychosis Can Be Beneficial or Harmful Depending on the Therapeutic Alliance, an Instrumental Variable Analysis. This study utilized a randomized controlled trial design, and it analyzed the difference in effectiveness among cognitive behavior therapy, supportive counseling plus routine care, and routine care by itself. It included individuals diagnosed with schizophrenia and schizophreniform disorder. The study, and this is, I think, really important for us to take in and understand and implement in practice, the study demonstrated that a good therapeutic alliance improved outcomes. Poor therapeutic alliance was damaging with regard to outcomes. And so, as a result, the authors discuss the importance of developing a strong therapeutic alliance with your clients who have been diagnosed with schizophrenia. And I think this is just natural for us as social workers, as we, one of the first things we do is build rapport with our clients, and the art of building rapport is really helpful for those in this field, especially those working with individuals who've been diagnosed with schizophrenia, as this article demonstrates that rapport and that good therapeutic alliance can really help your clients in terms of outcomes. So I thought that was a really great article to include as well. So thank you all very much. This is our first, or this is the list of references for part 2 of the presentation, the last half that we just talked about. So thank you all very much, and have a good rest of your semester.